Hi, so this is Sarah and I'm back with a new Asking for a Friend. So the question today is, if I don't pee right after sex, will I get a UTI? And it was a great question because everyone has heard this, I feel like. A lot of people are very diligent about voiding after having intercourse, and I wanted to see what the evidence said. So with the help of Crista, the two of us did a quick lit review. And it was interesting because the first articles that pop up, if you look this up, are from the 70s. And a lot of the advice sounds very 70s. So there was a study where basically from 79 where they found that there were more UTIs in a group that deferred voiding for 1 to 6 hours after having intercourse. However, the study was just basically a questionnaire, and there were no controls. There was no actually testing for UTIs. It was really, at least not that was reported in the article. So then we started looking a little bit later, and in 1985 there was an article that said some of the risk factors for recurrent UTIs included things like intercourse, but also orange juice, beer, wine, liquor, tea, cola, coffee, milk, using sanitary napkins or tampons, wearing jeans, and urinating more or less than 5 or 6 times per day. So that's pretty scary and makes it sound like if you have a bladder, you're at risk, which you kind of are. If you have a bladder and a urinary tract, I suppose there is a risk for infection. But then we went later, and the good news is, I have great news, that there have been no correlations found between voiding before or after sex, the frequency of having sex, the frequency of going to the bathroom, delaying voiding, which way you wipe, douching, hot tubs, pantyhose, or your body mass index. So the good news is that you can have sex and not worry too much about getting a urinary tract infection. However, if you are uncomfortable after or during sex, of course that's something you should get checked out. But even though you might be feeling symptoms like frequency, a little bit of irritation with voiding, you might not have a UTI. So before you ask for antibiotics, make sure that you get your urine tested so that you know if you're taking antibiotics, it's for an infection. Otherwise, it's likely that you're going to be okay.